Hey guys, it's your CajunStork here, Midwife Kyra, coming to you from the Natural Birth House, where we are hosting a mini birth fair and an open house for clients who are interested in delivering here, getting plugged in with natural health practitioners. We have chiropractors, massage therapists, placental encapsulators, perinatal mood specialists, and more. If you can't join us here in person, we'll be here till I think 11 o'clock. You're welcome to join us online. We'll leave this up for the rest of the week. If you have any questions, you can post them in the comments below and we'll be peeking in and try and answer those live for you. I'm going to plug us in and get us started with our very first speech from Tiffany Wyatt with Lafayette Placenta about the benefits of placental encapsulation.
Hi guys. First, I want to thank Kyra for putting this together. It's been a while since we really had any kind of birth anything here in our area, and so I'm just super excited that this is happening. So Kyra, thank you for making this happen and hosting it and all the things. So whenever we are pregnant and we grow a placenta, our brain has to regulate itself to balance the hormone processing with the placenta. So what the brain will do is the brain will downregulate itself so the placenta can take over that process. Now, whenever we deliver, it can take our brain 6 to 8 weeks to get back kind of full steam online. And that's why after we have a baby, we feel loosey goosey. We feel like we can't think of words, right? We feel hot. We feel all the things. So emotional, weepy. So the idea behind placenta encapsulation is that it bridges that gap of that early postpartum time. So this is a placenta transport kit. Whenever you sign up for placenta encapsulation, you get this transport kit, and there's a whole series of bags in here that helps to keep your placenta at the proper temperatures, safely stored with you so it doesn't get lost in the shuffle. We do placenta encapsulation pretty much anywhere you birth. Contraindications for placenta encapsulation. There are a few, but that's why you hire specialists, and we know how to help guide you through any problems with that. How it works is you just go online and you sign up. You get your kit in the mail about a month before your due date. And then whenever you're ready, you're in labor, you're going to wherever you're going to birth, or if you're home, and you let your care provider or your nurse at the hospital know, like, hey, I have a kit. I want to save my placenta. And they pretty much know how to do it. Pack it up, but there are also instructions with any of these kits. And then you text your provider, and we come within that day. We pick it up, and it takes 2 to 3 days to complete, and we bring it back to you. And this is honestly my favorite part of this whole process, is because whenever I come to you and I deliver your capsules by hand, we go over the ins and outs of how to take it, but also, it's also like a postpartum visit. So we're there just to check on you to see if, how's nursing going? How are you feeling? So, a lot of times as mamas, we feel so isolated in those early days and weeks, and we're there to help you with resources. It could be like, finding a breastfeeding support group, or maybe an actual lactation consultant that may be independent or freelance, or even a maternal mental health certified counselor, which we're so blessed to finally have now in our area. So I love that part because I really get to really be there for the mama. And then even after that, if at any point through the postpartum period anything feels off or wrong, or you need support, like, that you have another fellow mama who's done this process her own self, that you can call, it's non-judgmental, and talk to or text with, and you can get those resources at any point. So it's truly full service, I believe. So the capsules come in a nice little bottle. They look just like any other herbal supplement. They're not weird. They don't taste like anything crazy. And then we also make a tincture or a salve. And then we also have prints. I don't have one today, but prints. And then, so let's talk about, real quick, reported benefits. So I know for me, I did this for my second baby because after my first postpartum, I knew I wanted to do something differently than that experience. I suffered from postpartum anxiety. So we go into postpartum and we hear about postpartum depression and we kind of think it's just going to look like, oh, I'm going to be sad, or maybe I may not be interested in my baby. Odd fears that would invade my thought process, and it actually, prevented me from sleeping properly, even when I could sleep or I was supposed to be sleeping. So with my second, I did this, and it was a complete game changer. I mean, complete game changer. I did not suffer from anxiety, and things just went so much smoother. And also my milk supply was amazing. I was even able to pump and help donate to like a neighbor who was fostering a brand new baby, which is felt pretty incredible, right? I felt like I was a superpower there. Okay, so reported benefits. Let's just go down the list real quick. So there's improved mood and well-being, increased milk supply, improved energy, reduced postpartum bleeding, improved mom and baby bonding, reduced pain and fatigue, reduced anxiety, postpartum depression, baby blues, improved sleep, reduced inflammation, promoted healing. And because we feel amazing and we're getting out, and we're actually taking care of ourselves, our ability to get back to our physical health, and even with weight loss, sometimes it helps with that as well. So people out there are curious. They're like, oh, there are no studies, or that's maybe what your doctor says. And that's actually not true. There are actually numerous studies out there. And you can go to my social media. There's Acadiana placenta lady or Lafayette placenta encapsulation. And on most of my posts, I'll post like a study out of the numerous studies that are out there that supports whatever I'm promoting that day. I guess a little phrase I like to coin about this is like, this is truly the best gift a mama can give herself for her postpartum, to have a happy postpartum. Talking about the benefits, what are some of the things that cause those benefits in our body, reported benefits in our body? So we have natural iron in our blood, and iron is actually kind of hard. I'm sure Kyra knows with her clients, it's hard to take in your body to consume, and but this is your own natural iron, so it's like it's completely bioavailable. There's corticotropin stimulating hormone that helps with stress and anxiety and baby blues. There's, of course, the feel good love hormones is oxytocin, which helps our bodies to get back to size quicker and for us to not bleed as long. Also, oxytocin is amazing. It's a bonding hormone, so whenever it's released, you feel loved and like kind of sunshiny inside. And it also helps for sleep. It'll sometimes make you sleepy first off. That's why sometimes when we first start nursing, it releases that oxytocin. All of a sudden, we get super sleepy. It's oxytocin, which is amazing. Progesterone is a anti-anxiety, pro-healthy sleep hormone. So there's a lot of, if you go to LafayettePlacenta.com, the facts page, there's tons of information, what's in there, the studies, the links. So if you have any questions, I guess just comment, let us know. How many times a day do you take it? Okay, great question. So let's go back to that. We were talking about how our brain is getting back online. So the idea is at the very beginning, we're really, really lacking that hormone processing. And so we take the suggested dosage is 2-3 times a day. And that's for 4 days. So you get really nice and infused with it. And then after that, you're going to start to titrate down where it's 2 twice a day for up to about 2 weeks. And then after that, it's 2 once a day. And then eventually, 1 a day. And then most mamas have some left over. And we highly recommend holding on to that because it's not only good for those early postpartum days, but whenever your period comes back, we have a hormone shift at that point and our milk supply can drop. So it's good. And our first period or two after having a baby can be pretty intense. Mine were, at least. And so it can help with the pain, help with kind of getting through that, the mood support, but also the milk supply. So you can take 1 or 2 a day during your first few periods to help, even if you completely finish your capsules, it helps with that. So the idea is we take a lot, we infuse the body, and then as our brain kicks back up, we're like taking less and less. Good question, thank you. And another reason to hold on to any leftovers is they're actually there's evidence showing it's really good for when we start going through perimenopause or menopause. So basically any hormone shift that we have in our body that's related to our female hormones, the capsules can be supportive of. So,
I have a thing to say.
Yes, ma'am.
My clients ask me often, and I love how you used to say it. It doesn't say placenta. It says postnatal supplement.
Yes, we try. So we do understand that some people are still uncomfortable with everyone knowing. I know for me, when I did mine, I didn't. Only my husband knew. Like no one knew, but then everyone was like, "Oh my gosh, you recovered so quickly." I was like, "Do you really want to know?" It's kind of weird, you know. And then they're like, "Oh, okay, well now that makes sense." So yeah, we really try to be very what's the right word? Discreet. Thank you. We try to be very discreet for you. When we're picking up or delivering, we try to be quiet and quick, and we try not to like blast placenta all over all the things. So yeah. So that is helpful. We do try to be discreet. Thank you. What else? Anything else?
Let me see if any questions come up online throughout the morning. I'll call you back over to the screen because I prefer to answer them live.
Any questions? She's looking to see if there's any questions, and if not, I can always come back later. I'm not going anywhere. So
prenatal vitamin while taking your placenta, and if so, can you take them at the same time?
Good question. So especially if you're breastfeeding, yes, absolutely. Always take some sort of multivitamin during your postpartum. I found that my postpartum, you need the extra, of course, nutrition, and it's obvious why whenever you're pregnant, but in postpartum, it's not quite as obvious, but it is almost even more important at that point, especially if you're breastfeeding. I found that breastfeeding took more out of me nutritionally than being pregnant did. So definitely take your whatever supplement. It could be your prenatal, those are amazing, or any kind of multivitamin along with your capsules. Yes. Yes, and you don't have to eat with your placenta, your capsules if you don't want to. But it's always helpful anytime you're taking any kind of high dense nutrition, if you eat with it to help your body break down what's fat soluble and water soluble. Sorry, it's not going to upset your stomach. So
next question from Stephanie Derwin says, how many total pills do you get? Does it depend on the size of your placenta?
All right, how many pills do you get? Yes, it absolutely depends on the size of your placenta. So an average 7-pound baby will get around 150 or so capsules. Now, we do have two different methods that we do placenta encapsulation. There's the steam method and the simple method. And the steam method is we get the placenta, it gets, for both of them, the placenta gets photographed and weighed and cleaned and prepared. And then the steam method, of course, gets steamed. And then the simple method it just skips the steaming, and then both of them go straight into the dehydration and the final encapsulation. The steam method will shrink the placenta a little bit more than the simple method, so you'll get more capsules out of the simple method. So let's go back to that 7-pound baby. If you're doing the simple method, you'll probably get around 150 to 170 capsules. The steam method, you'll get around probably 120 to maybe 150 capsules. And then there is a difference between the simple method. The main difference is the progesterone is still present. Whenever the steaming degrades that progesterone. So mamas who've had a hard time breastfeeding or they're breastfeeding for their first time, the simple method may be the best. Not simple. The steam method may be the best option for you because that lack of progesterone is what actually signifies your body to start with your milk supply and production. Now, if I've had great milk supply, I have no problems breastfeeding in the past, I'm just looking for energy and mood support, then the simple method is the one because that progesterone is really amazing with baby blues, anxiety, sleeping, and then, of course, when we sleep well, we have more energy. But you can also do half and half, which is the most amazing way to take your placenta. You can start with the steam method, and then we take the other half and we make the simple method. So you're getting a smaller baby will produce a smaller placenta. And so you'll get less, and then it depends on the method you choose. And of course, a bigger baby, like my BFF, one of my BFFs, She, her baby was 10 pounds. She had a 10-pound baby. She delivered that baby naturally and vaginally. So I did her placenta, and I did it with the raw prep method because she suffers from an anxiety disorder. And so she got, it was around, it was just over 300 capsules. So again, it just depends on your baby, and some mamas, even though they have a small baby, they have a bigger placenta, or a big baby, they have a smaller placenta. But I would say 80% of the time, the size of the placenta and the size of the baby are pretty, like, it's very related. I can generally guess. I'm like, oh, how big was your baby? And they'll tell me, I'm like, I bet we're gonna get about this many, and it's usually accurate within about like 25 capsules. So
Next question from Marissa. For moms that live a little far from the Lafayette area, how would we get the capsules?
okay, so there is an out of town fee. So if you're delivering in town, we just pick it up from wherever it is here in town. If you're out of town, we arrange like a meetup point. So like we have mamas in like North Louisiana, we meet up in Appaloosa. So you have mamas in East Louisiana, we meet up near well, it depends if it's like New Orleans East, we meet up near Gross Tet. If it's like Southeast, we meet up near like New Iberia or Jeanerette. And so there's a little fee for making that extra trip, but then I express ship them back to you. They get all super packed up, and they get express shipped back to USPS. And so it's like a small fee, and it kind of takes care of all that, the shipping and all that. So
what is your radius that you wouldn't have to ship it? Is it just Lafayette, or is it like Jennings?
No, I'll deliver to Jennings. I'll deliver to Opelousas, like hand deliver. So really pretty much outside, probably outside like the 20-ish mile mark.
Okay.
Yeah.
I think that's it.
Awesome.
Don't be nervous if 50 people were watching you.
Yay! It's easier whenever you don't see their eyeballs,
Yeah.
So check me out, livehealplacenta.com. Been doing this since 2013. I've known Kyra since 2009.
You were my second doula patient.
She was my doula, my baby who's about to be 12. And it was an amazing hospital, natural birth. She was amazing. So it's been like a joy to see her journey and her growth and her success. So amazing. So thank you again, Kyra, for hosting. And check me out. Any questions, let me know.
All right, so if you guys have any questions for Tiffany Wyatt from Lafayette Placenta, go ahead and post them in the comments below, and I'll have her pop back on later to answer any questions about placental encapsulation. Next on our list is our first positive birth story from our awesome Dr. Brytani Laird from Magnolia Family Chiropractic. She's going to start with telling her birth story, and then she's going to give us a speech about chiropractic and how it can help with the discomforts of pregnancy. If you're interested in learning more about Dr. Brytani's story, we actually have her birth video, her birth story up on YouTube. And behind us, we'll be playing pictures from her actual birth from her photographer, Catherine Walker. Her son, Barrett, so her son, Barrett, was actually our 200th baby. November of 19. November of 19. And we actually hired her a photographer, and we were going to make a big stink about it, and then COVID happened and we got super busy and never got around to it. So I'm really excited for you guys to see these pictures and let Dr. Brytani share her story about midwives with you.
Hi everybody, I'm Dr. Brytani. Like Kyra said, I am a BirthHouse mama ×2, so I've had 2 babies here at the BirthHouse, and I did have a hospital birth. So Kyra wants me to do my first birth, Brody, which was 8 years ago in April. Little bit of a traumatic birth. We'll make it really short. So I went in late Friday night on April 5th. Had kind of a weird night throughout the night at the hospital. They were coming in constantly checking me, couldn't get any sleep. The next morning about 7 o'clock, I felt like I was ready to push. I was ready to have a baby. And the nurses kept saying, just a little bit more. You're not complete. Like, you're almost there, 95%. And so long story short, Brody went into distress. Doctor came in, was kind of in a panic. Right after the doctor came in, 3 or 4 nurses came in really quickly, and they had to do an episiotomy really quick, and they used forceps. Basically without any consent. It wasn't like, hey, we're about to do this is what's going on. It was just like, Brody had his head crushed by the forceps, so he was born with a subgaleal hemorrhage. So we spent over a month in the hospital in the NICU, which is terrifying for your first baby. He was given 3 days to live. It was a really hard time for us, me and my husband and our entire family. So that is a little bit backstory of him. He's 8 years old, perfectly healthy now, plays football, does American Ninja Warrior, loves sports, super active, crazy, smart. He's taken an AR test all summer for school. He's got a little nerd in him. He loves it. So he's a great kid now. But so that kind of made me want to have a baby here. So when I got pregnant with Brooklyn, we switched into care around 30 weeks just because I told my husband, I was like, I don't know that I can go to a hospital and have a baby and not have a panic, you know? So we decided we switched into care kind of late. We had just moved to Lafayette area in April, and we switched here to the birth house in May. Brooklyn was born in August, so you can see the short time frame there. The prenatal visits from the first time I met Kyra were just amazing. They were long. They were super just all about me and the baby, 30 minutes to an hour long, depending on, like, you know, what the visit was about. But it was all about us. It wasn't like, hey, let me check the heart rate. Oh, you're good. No problems. Bye. You know, she was asking questions like, do you have this, this, this? And I'd be like, oh, wait, I did have those symptoms. Like, you know, not even thinking that it was important to tell her. So for Brooklyn's birth, it was pretty quick as well. My water broke at 7 a.m., called my midwife and was like, hey, my water broke, no contractions, doing good. I guess I'll have a baby in the next day or two. That's what I thought. 45 minutes later, my contractions started. I'm calling my husband. He told me, no worries. So immediately, we got to the birth house about 9:30. My husband made it to the birth house about 10:45, and Brooklyn was born at 11 a.m. So he barely made her birth. He got here for the, you know, the good part, I guess. But the experience just in that short amount of time, you know, I was at the hospital for 10 hours or so, and then here just for like 2 or 3, and just it was so intimate. It was all about me and the baby and what I needed, and it was so focused. You know, the lights are dim. It was just, after she was born, they tucked us in the bed, and for an hour, me, my husband, and Brooklyn got to just have, you know, that golden hour where we nursed and we hung out. They would come peek in, and, you know, they would check her, make sure she was good, check me, but it was so quiet and peaceful, and not, oh, let me flip the lights on, let me look, let me, you know, it was just calm and peaceful. So we were home by 3:30 that afternoon, and once we got home, we decided to call our family and tell them we had a baby. We like to keep the whole labor, delivery, and everything a secret from our family until once the baby's born. They may not enjoy that, but we do. And then, so when we got pregnant with Barrett, we knew without a doubt, like, we wanted to have a baby here again at the birth house. It was kind of a little different. I was working here for Barrett's birth throughout his delivery. So I would go in and see a patient, and then Kyra would be like, oh, hey, your appointment's today. But it was a break for me to have a prenatal visit, and so it was really nice. The prenatal, and without a doubt, it was amazing. The appointments were still, and even being like a second-time birth house mom, the appointments were still so amazing, and just, I was like, oh, wow, like 30 minutes to an hour, and just talking about me and the baby, and, you know, making sure that everything was going right with my pregnancy. It was awesome. So for Barrett's birth, was a little different. We had 9 days of prodromal labor. And if you're not sure what that is, it is basically where you think you're in labor and it's not actually like true labor where you're going to be delivering a baby anytime soon. So it was a very rough 9 days. I know 2 days before he was born, I was having contractions every 2 to 3 minutes, probably for about 6 hours. It was definitely a rough day. It was one of my busiest days at work, doing what I love, but definitely rough. Wednesday afternoon, it was day 8 or day 9 of prodromal labor. Very emotional. It just becomes mentally, physically overwhelming and exhausting. I think I called Kyra and probably cried for an hour just because I was like, is the baby coming? Like, am I doing something wrong? It just becomes almost a game in your head. Like, oh, that's not real. You're just imagining those contractions, or, that's, it's so exhausting. So if you've ever experienced that, baby will come. It's hard when you're in the moment to breathe and relax and just let your body do its thing. So I decided to take Thursday off. So I went and had a 90-minute massage with Lexi, the massage therapist here at the BirthHouse, and that was amazing. So you might see in some of the pictures, I have cupping on my back. So that is not bruising from my mom or my husband. That is from Lexi. So yeah, I had an amazing massage with her. Went home, took a bath, took a nap, woke up. My husband was working nights at the time in Lake Charles. He wanted to go to Shooters and look for some waiters because, of course, we had a baby during hunting season. So we went to Shooters, walked around. When we left Shooters, I called Kyra and was like, hey, things are picking up, but I'm going to go home and have dinner with my kids, and I'll call you later. So we get home. One of my really good friends brought my kids pizza artista, which they loved. And then she was kind of like, ooh, I think this is real. Like, I was, things were changing. She could tell a difference. So she called Kyra, was like, hey, I think you need to call Britt. Let's go ahead and meet. So, of course, I had sent my husband to work. So I'm best at sending him to work when I go into labor. So I called him. I'm like, I think you should come home. I think he was clocked into work for like 6 minutes maybe. By the time he got to Lake Charles, clocked in, and then had to turn around and leave. So we got to the BirthHouse about 6:30. And when I got here, everybody was here waiting on me. I had my birth photographer at the end of the hall. They were setting up the pool. And so they were all ready. So we get here and Kyra checks me and she's like, yeah, we're going to have a baby soon. So I think I was about 7 or 8 centimeters once I actually arrived, which was awesome. And we labored in almost every position, which was a pretty cool experience. Barrett's head was kind of in a funky place, so they had me in different positions. I had what's called a cervical lip. So just trying to get into a good position so baby could get into a good position to be born. My water broke at about 8:20, which was awesome because my water had broke way before labor started with Brooklyn and with Brody. So when my water broke with Barrett, about 20 minutes later, he was born. So I think he was born at exactly 8:40. And once again, it was an amazing birth. After he was born, they checked him out, made sure everything was fine. And then we got to snuggle in the bed. We had him in the same room we had Brooklyn, so we got to snuggle in the same bed for an hour and really experience that golden hour. He nursed like a pro. I was still nursing Brooklyn, so my milk colostrum, it was already in and ready. So as soon as he was born, he was able, and so we had a really good, amazing hour with him. After I ate my lunch or my dinner, it was actually the same meal that I had with Brooklyn. We had Raising Cane's with lots of ketchup and also a large root beer. So same meal postpartum. Didn't do it on purpose. It just kind of happened that way. But yeah. So I remember he was born at 8:40, and about 10 o'clock, Kyra and then walk in, and I'm sitting on the floor in Indian style, just hanging out. I felt amazing. And so they're like, what you doing on the floor? I'm like, I don't know. I'm just comfy. Like, my husband was rocking Barrett. Like, we were good. And so he was born at 8:40, and we were home by midnight, which is awesome. So, like, Brooklyn was born at 11 right before lunch. We were home by 3:30. Barrett was born at 8:40 at night, and we were home by midnight. So it seems short, But because the labors go so smoothly and they watch you so closely, and then postpartum, it's all about you and the baby. There's no other patients for them to worry about. So it's very, very, you're closely monitored. Probably you're monitored here closer than in a hospital because you're the only one they're here to look for. So they're constantly, like checking in on just you. They have no other, they might be answering texts from other clients, but I mean, that's so quick and easy. They're just all about you. So, people ask me a lot, like, you were ready to go home, that soon after? And I'm like, yeah. When I walked in, like, I didn't need them to put me in the wheelchair. I didn't feel woozy. I just felt amazing. Got home, got in the bed, snuggled up with my baby, and it was nice to be home and, comfortable versus in a hospital bed. And also the beds here are not like hospital beds either, so they're comfortable as well. So just the whole experience from pregnancy to postpartum with the BirthHouse is amazing. So after both of their births, I still met with the midwife. So they came in on day 1. Day 2, they call you. They're a text message away, like they are the entire pregnancy, literally anytime. And then on day 3, they come back to your house again. So that's awesome too. You don't have to leave your house. You can just hang out at your house and they come to you, which is nice, especially postpartum. I don't know exactly all the days, but I mean, they're with you the first 6 weeks, It kind of gets a little mixed up. But like I said, they're just a text message away. And then for your postpartum 6 weeks visit, instead of going into your OB's office and having a full formal visit, Kyra usually does, I don't know what you call them, like little get-togethers, like a party. So all the moms that delivered close to when you delivered and are around anywhere from 5 to, I would say, 8 weeks postpartum, we come out, we hang out here just like we are today. And one by one, she'll take us back and check in and make sure everything's okay. And you also get to hang out with other moms who are going through the same postpartum you are, and you can just kind of ask questions to them and talk with them, and they become friends. And so it's a really, really nice experience. Anything else I'm leaving out about all the births? No. I feel like that was a short condensed of 3 births put together. Also, in some of these amazing pictures, you'll see Catherine actually caught me adjusting my baby. He was probably, I don't know, 5 minutes old when he got his first adjustment, which was pretty awesome. We're not there yet, I guess. But eventually, if I see it, I'll remember. Oh, I did have to have IVs during Barrett. So, my pregnancies are pretty rough in a sense of I have a lot of sickness. So, I become a pro at throwing up, unfortunately, during pregnancies and even in labor. So something awesome about here, I did, get pretty sick through a lot of my contractions. Rachel, the birth assistant, soon to be midwife, wherever she is, in the middle of a contraction, stuck me with some IV fluids just to kind of give me some energy. No one ever gets it the first time, and Rachel did in the middle of a contraction, not even telling me to be still. She just did it amazing. So I did have some IV fluids just to kind of give me a little energy back just from being a little sick and not get dehydrated, because that's super important. You get to eat and drink during your labor here at the BirthHouse. But when you're sick, it's kind of hard to keep drinking and eating. But yeah, so I forgot about that. But yeah.
It's a pretty given birth.
I know, right?
Thank you. Some rough pictures there, but yeah, it's such an amazing experience. Catherine Walker, after she makes this beautiful, incredible book, and every time I open the birth book, I just feel like I'm jumping into the page, like those TV shows you see where the little characters jump in the page and then they're living the experience. Like that's how I feel whenever I'm reading or looking through Catherine Walker's the birth picture book that she gave for my birth. It's amazing. So yeah. So that is my 3 birth stories. Super short. So I will talk a little bit about chiropractic. So I am the chiropractor here at the BirthHouse. I own Magnolia Family Chiropractic. So I am Webster Technique certified, which is a technique for pregnancy. It's a specific chiropractic adjustment and sacral analysis with the goals of reducing SI dysfunction during pregnancy. So it focuses a lot on the round ligaments, that pubic pain, lightning crotch symptoms that mamas experience, sciatica, low back, the glutes, even tight leg muscles. So the Webster technique is just a way for us to analyze and treat a pregnant patient a little different than non-pregnant patients, because we focus on so many things that our bodies go through as our baby grows, as that curve in our back gets a little stronger, the center of gravity shifts. We also treat, head to toe, just like if you were not pregnant, but that Webster technique really focuses on this area. So it's important to try to find a Webster certified chiropractor when you are pregnant and expecting a baby. I'm also a BirthFit leader. So what that is BirthFit focuses on movement. So think of pregnancy and postpartum fitness. With a big emphasis on diastasis recti postpartum. So that is the separation of those ab muscles that happens sometimes after your first baby, sometimes after your third baby, sometimes, it may never happen to moms. Sometimes it's unfortunate. We do everything we can during our pregnancy, but we still have a little bit of that muscle separation. So I work with moms on proper exercising, not crunches like everybody thinks. So proper exercising and muscle work to help bring those ab muscles together and decrease that separation that you may get during pregnancy. I'm also vice chair of Acadiana Breastfeeding Coalition and on the steering committee for the Louisiana Breastfeeding Coalition. So right there, those two things tell you I love and I'm very adamant about breastfeeding and helping moms have the support that they need. I also, just helping babies eat properly, whether it's a bottle or a breast, is super important to me. I see a lot of babies with tongue and lip ties. I've had 2 babies that have had revisions, so I've kind of experienced it firsthand on how difficult it is for that baby to take a bottle or a breast or a pacifier with that tongue and lip tie. And we look at all the jaw movements and how that tongue is moving to make sure that baby can eat properly. Because what can happen is if baby can't eat properly as a baby, that just keeps building to where they're not able to eat solids as well. They're not able to talk maybe as clearly because that tongue hasn't been moving like it should throughout the whole childhood or the whole infancy. And it even narrows their mouth. So you might have your, preteen that's getting orthodontic work and they're like, hey, we got to put a spacer in their mouth, or, put one of those things at the top where they have to crank it all the time to open out their palate. So all of that leads back to tongue and lip ties as a child. And you'll see quite a few. I have lots of adults that come in and they have tongue and lip ties and they had all these problems growing up, or maybe they had one problem, and so it all links back. So I focus a lot on that. As well as when I treat babies, I'll just kind of go into why I see babies most often. So for feeding difficulties, of course, like I said, colic, reflux, gas, ear infections, constipation, all those things, hates the car seat, flat head, torticollis is a big one. Sometimes we don't think of birth being as traumatic as it can be, but babies do have to go through the birthing canal or even a C-section. They're usually pulled up by their head and their neck. So if those muscles get tight, that's those babies that love to lay on one side, or they only, you can only give them a bottle on one side, or they only want one breast. So I work a lot with their muscles and stuff in their neck to try to help loosen that up. Some of the top reasons that I see pregnant women are sciatic, pubic bone pain, that lightning crotch that women get that is super uncomfortable, tight shoulders, mid-back pain as our breasts grow during pregnancy, even postpartum. That's super, we're holding the baby all the time and we're staring at the baby because, who can't not stare at their newborn baby? So we work a lot on shoulders. I also do a lot of taping in my pregnancy. In my practice, whether it's pregnancy, infancy, or just, my regular non-pregnant patients. So I do a lot of shoulders, ankles for swelling, carpal tunnel, low back pain. I even tape moms to where we can kind of lift up on their stomach to kind of help take some, so this is actually Barrett's first adjustment. Sorry. So I will say, baby adjustments, and he's getting adjusted right here too. So baby adjustments are super, super gentle. It's like the pressure you would check to see if a tomato was ripe. It is super, super gentle. Most people would think I'm just holding my newborn here, but he's actually getting an adjustment. So you can see I'm working at the top of his occipital bone and his little head right there. And then I just kind of work my way down his spine, making sure everything is even from side to side. My fingers right here just barely pushing. My husband thinks he's doing it. He's not doing anything. He just had his hand there. It's just my hand working. But yeah. So like I said, baby adjustments are super, super gentle. Most people don't even know that I'm, adjusting a baby. Sorry to get off topic. So back to taping. So many different reasons why I tape, and there's so many different protocols. So we can tape for muscle memory, we can tape for pain, inflammation. I usually tape for pain and inflammation more than anything, but there are other reasons why we may tape. I also do a lot of cupping during my treatment with patients. My photographers, when they're armed, shooting camera, hair stylists that are holding their arms like this all the time, will do a lot of cupping around their shoulders, work all those muscle work. Even bodybuilders that I have that come in and their shoulders are just super, super tight. They don't have good range of motion. But we can tape low back. I can tape down your leg, your feet. I do a lot of cupping and taping for plantar fasciitis in the bottoms of our feet. Like when you wake up in the morning and your heel is killing you and you're like, oh, I can't walk. Lots of taping and cupping and muscle work for that. But yeah, so I kind of do it all. I like to do everything hands-on. I'm a little different in some chiropractors. I don't use anything that plugs into a wall really. I don't use e-stim or ultrasound. I do everything by hand. So I have my muscle work, my muscle tools that I use. Of course, my hands and cupping and taping. I like to do everything myself. But yeah, if you have any questions, you can follow us on Facebook or Instagram, Magnolia Family Chiropractic. Yeah. And that's it. Thank you all for listening to me today about my birth stories, and then about a little bit about chiropractic during pregnancy, pediatrics, postpartum, and then just adults. So remember, I treat all ages, 0 to infancy. Sorry, 0 to 100.
Kelsey wants to know, does it help with acid reflux or colic?
Yes. So chiropractic adjustments help with acid reflux for adults and for babies, especially colic for babies. But basically, think about you want your body to be aligned, everything even from side to side, so that all those nerves off your spinal cord can go out to the areas that they need to go to, so that way your body can function at its highest potential, whatever that may be. So a lot of patients we have, they'll come in for something symptomatic, and then we get them on what we call a wellness plan. So they'll come in every 6 to 8 weeks, maybe, just to come in, make sure all their muscles are equal, all their joints are aligned, to help prevent injury and to prevent symptoms occurring with things.
Alyssa wants to know, is there any help with chiropractic care for the postpartum that she's still struggling with sciatica?
Yes. So I always recommend for my patients after they have their baby to come back when they bring their baby for their newborn exam. So sometimes after we have our baby, our bodies just go back and they're fine. And sometimes we have new pains after that maybe we didn't have during our pregnancy, or we have the same pains during our pregnancy. Postpartum. So if our hips are imbalanced, whether it's during pregnancy or postpartum, that's going to give us those SI and sciatic pain. So we want to make sure that after we deliver, that we come back to get adjusted and get evaluated to make sure that our hips are aligned, so that we don't have that sciatic pain and that SI joint dysfunction. So definitely postpartum care is just as important as pregnancy care for chiropractic.
That's it.
All right.
All right.
Thank y'all so much. And if you have any more questions, just let us know.
Thank you. All right. Well, thanks for watching, you guys. That was Dr. Brytani from Magnolia Family Chiropractic. You can follow her on Facebook and on Instagram. Our next birth story is going to be a positive birth story from Lisa. It's going to be her first BirthHouse birth. And we hope you'll join us.
My name is Lisa Ducote. I had my second child here at the BirthHouse. I want to talk a little bit about why I chose the BirthHouse while she's getting this set up. So when I was pregnant for my first, I knew that I wanted a BirthHouse birth. I had come and had the consultation with them, and so many family members that are in the medical field were saying, so many things can go wrong. One of them was a NICU nurse. They literally see the worst of the worst. I get it. But so many family members were just saying, like, you need to at least have your first in the hospital, and then you can see. Well, with all the pressure of that, I was just like, okay, I'm tired of hearing it. I'll have my first in a hospital, get it over with, fine. So we ended up having a hospital birth. Interventions were used that I had specifically said I did not want. And I know this is really trivial, but it plays a really big part at the BirthHouse. But my labor was really short at the hospital. And I asked, I don't know how many times, for ice chips because it's the only thing you can have. And I never got them. And 3 years later, I'm still pretty upset about that. I mean, they don't let you have anything and they won't give you the one thing you can have. So that was something. And I gave birth before 8 o'clock in the morning, or right at 8 o'clock. So I mean, they could have had other things going on, but it's ice. But interventions happening, it was not the experience that I was going for. I delivered naturally. We had no complications. My son was completely fine.
And 9 pounds.
And 9 pounds, 4 ounces. You can do it. Even if they say, oh, it's projecting big. Your body is made for this. You can do it. There's this quote that I love. There's a secret in our society, and it's not that birth is hard, but it's that women are strong, and you can do this. So I decided. There we go.
Nope, hang on. It's too long between it. It's okay. Keep talking.
Okay. So when we got pregnant the second time, we were living away for a while. We moved back here, and I told my husband, I was like, the BirthHouse. There's no option. I don't care what people say. If anyone says anything, we did it. It was perfect. BirthHouse. So I made the appointment with Kyra, came in, set it all up, and we started our journey. And like Dr. Brytani said, the appointments are about you, your baby, and your spouse. It's literally questions. I bring my husband because I am the worst at remembering things. So he would say, like, no, you have this going on. And I'd be like, oh yeah, okay, yeah. What do we do about that? And she has an answer for it. And it wasn't the real quick, rushed in, yep, you're good. You have any questions for me? She asked the questions. She went into nutrition and diet and how things are going with your health, with what you're putting in your body. And not in like there's no judgmental way. It was a very much so, this is, what are you eating currently? You tell her, and she's like, okay, that's great. You may want to add this or take out this. It was a very easy way. I didn't gain a lot of weight for either of my pregnancies. And she guided me with, hey, you need to be here. Not before, my doctor was just like, cool, you weigh this now. But she actually cared about it and said, no, we need you to be here for the health of the baby. And then as far as, we were able to bring our son into the appointment. She has some toys and stuff that he was able to play with. So that was also helpful because it wasn't like a rush of, oh gosh, I have to find someone, figure it out. For the actual delivery, which you can see, well, we were able to go outside and walk around. At one point, we all sat in the communal area and they had coffee. I had nothing. But at some point, there's going to be my snack pile. Like, I had Ritz Bits, I had pickles. My husband literally just bought this pail of food because I called him and I was like, hey, I think we're in labor. You might want to go drop Kane off and come. So, and he did that. He went to the store, grabbed whatever he could, came here, and we just shared food with everyone, whatever was available. But it was such a relaxing birth. The environment was not stay in the bed. At one point, Kyra was like, hey, if you want to take a nap, go right ahead. And we did. We took like a 30-minute to an hour nap, my husband and I, in the same bed, because it's not a hospital bed. It's a bed that would be in your home. And I think our birth team may have also been able to get a little break because they had also been up for a while. I had an appointment with Dr. Brittany at 11 that day. So as soon as they opened, I was like, hey, can we move it up some? And she worked with me. She was like, yes, absolutely. Come on. So we went, we got our adjustment. I did have a lot of sciatica pain throughout my pregnancy. I saw Dr. Brittany the whole time. And it was amazing. That was our little coffee table time. Who knows what's happening? So we ended up,
Trying to get your
Stomp,
labor
stomp,
going.
squat.
Stomp,
Yeah.
squat.
Yes. My labor stalled out at one point, and Emily, the office manager here, she was like, just stomp and squat around. So I literally tried that. I tried racing my husband throughout the space. We just, whatever we could do to kick things back up. And so it seemed like time just flew by. Everything was just so jovial and just whatever we needed. Again, like Dr. Brittany said, it's just you. There's no one else for them to be checking on or tending to, or hold on, so and so is delivering. I'll be back. So it was one-on-one care, and it was amazing just how inclusive everyone was. And it wasn't like, oh, you're birthing, you need to stay in this room. You have the facility, you can kind of move around a little bit and talk and enjoy yourself some. So we, did the labor thing. I ended up sitting on the toilet to get contractions going a little bit more, and I was like, this is happening. So, but I knew that I could not birth a baby on a toilet because that's just weird. So, we tried to move really quickly onto the bed, and I ended up delivering while standing up. And Annalisa was here at the time. She was another midwife, and she caught my baby midair because I did not prepare for this. It's coming. And so after we laid on the bed, I am that person, I don't do icky things. And so they handed me my baby, and they were like, it's okay. And I'm like, I know it's okay. Everything's good. It's just icky. So we kind of toweled her down a little bit. We don't find out what we're having, so it took a minute for us to realize, like, oh wait, what is she? And then we got to all snuggle in the same bed together. We enjoyed our time. My husband went and picked up a smorgasbord of food from La Hacienda right here, and we just shared our food, and everyone just was amazing. It was very much the birth that I wanted to have. And now we look forward to whenever the next time comes up. It'll definitely be here at the BirthHouse. That's good. So,
yeah, you're about to catch her in the air.
It's coming. It's happening.
You see Annalisa squatting. Her face. She's like, oh gosh. Stop saying it. It's coming. Sure.
Yeah, it's like it was so quick.
That was an impressive catch. Like, it was like, shoo.
Yeah, fetal ejection reflex. It's real. It happens.
She's like, okay, this is how we're doing it. And then they totally paused for like,
oh yeah,
like a minute.
Yeah, they were like, you can lay down, and I was like, okay.
And Annalisa's like,
yeah,
holding her.
Take your baby. Okay, great. Sure.
That was awesome.
So yes, BirthHouse. I mean, the people between the staff and the additional businesses that they have through here with like Magnolia and the massage therapist. Everyone is just so accommodating, and this is obviously what their path is. They're chosen for, and they do it so well. So, and Catherine Walker. She catches everything.
Thank you, Lisa. Okay, so we're a little bit ahead of schedule. So I'm going to have one more positive birth story sneak in before we speak with Lindsey Latiolais about perinatal anxiety disorders. Sarah she's nearly my sister. We were raised as siblings, and she's had 3 babies. I've been to all 3 of her births, and she's going to give her positive birth story today.
So, hi, everybody. I guess I'll start off from first, second, and then third, since I've had 3. My first one, first time mom, oblivious to having a baby, but not necessarily comfortable, probably is the best word, being in a hospital setting. My mom passed away 4 months before my baby was born. And so the hospital and doctor environment was not one that I felt very comfortable with, given what we had dealt with my mom. But yet I was still a new mom, didn't know what to expect. And I said, you know what, I'm going to go to the hospital, have the baby. Actually, the first experience I had at the hospital was a positive one. I felt like I was supported by the staff. They understood what I wanted, that I didn't want an epidural because I'm scared to death of needles. And even though my water broke, they gave me the opportunity to continue on and not progress me with medicine. I progressed naturally. And even though it was challenging, gave a natural birth in the hospital. And it was actually a really good experience. I can't say a whole lot about it, except for when you go into the hospital, they put the IV in your arm. I think it is the absolute worst thing. I think it hurts so bad. So the next birth, I decide that I feel like I understand the process a little more. I feel a little more comfortable. But unfortunately, I really wanted to do a home birth, but I couldn't. I had gestational diabetes for my second, and very disappointed. Huh?
That took meds.
Yes, I did take meds. So I was very disappointed because I really wanted the option to do a home birth, but unfortunately my body would not allow me to. So instead, I said, you know what? I know what to expect this time. I'm going to stay home as long as I can. Sure enough, I stayed home to the very end because I stayed home. I knew what I was comfortable in, so I got in the bathtub. I stayed in the bathtub for probably way too long. And then I told my husband, I was like, it's time to go. He goes, are you sure? I'm like, yes, I'm 100% sure. I call Kyra. I say, Kyra, you need to come. She goes, now? I'm like, yes, now. Come now. So we get to the hospital. This is where unfortunately, I just kind of turned off to a hospital, is when I got there. I kind of got given a lot of pressure of why I waited so long and birthed at home. They were not very nice to me about it and said, why did you wait? And I said, because I wanted to be in a comfortable setting. I like my house. I love being comfortable in my own setting, in my own environment. And eventually they put me in a room, and within 20 minutes, here comes the baby. I think Cara barely made it in the room. The doctor barely made it in the room because I literally stayed at home the whole entire time. So have the baby, ask profusely, do I have to stay here? Like, I want to go home. I don't want to have to stay for multiple days. And they say, well, you had gestational diabetes. We need to watch the baby and watch you. And I'm like, I just want to go home. They said, no, you have to stay. So again, stayed for the 24 hours. My oldest wanted to be there with us because she felt excluded. And so I said, you know what? Here we go again. Unfortunately, unbeknownst to me, 3 months after having my second, I'm pregnant again. Wow, how did that happen? So I'm like, I said, here we go again. And I think my husband nearly fell to the floor. So this time I just came off the second. I know what to expect. And I just keep thinking, please don't let me have gestational diabetes. Like, if that is the one thing that held me back, don't let it happen again. And sure enough, third one, no, didn't have it. I was fine. So at this time, I knew that I didn't want to be in a hospital environment. I knew my house is my happy place. Water is my happy place. So I said, Kyra, would you be willing to come to my house and do it? I love the birth center, but like my house is my everything. And I just had a baby. So I wanted all my kids to be there with me. And he was so little that I said, can you please come? She immediately said yes. As she said, we're like sisters. So she was more than willing to come to my house. Again, I kind of knew what to expect. My water broke. Yeah, my water broke. And I called Kyra. I said, look, I'm not progressing, but I think it's coming. So I said, get some rest. I know it's going to happen. I swear, probably 1, 2 o'clock in the morning, I call her. I'm like, it's time for you to come. I know we're not that far. And so I stay in the bathtub as long as I can. But for the first time ever, for this one, I actually got sick. Like I got so dehydrated, I kept throwing up. And this was the first time I ever experienced this. So I kept throwing up, and it came time to push, and I was fatigued. Like I could not find the energy. Kyra did her best. She tried to give an IV in multiple different areas that we don't want to talk about.
Not Rachel.
And so we unfortunately I couldn't get the energy. So Kyra did what she needed to do. She called for an ambulance. They came and they gave an IV. And they it felt like they thought I was insane because when they walk in, they're like, what's going on here? And she said, all she needs is an IV. Just give her an IV. And sure enough, 5 minutes after that IV got in my arm, I pushed that baby out. And it was the most wonderful experience. I really wanted to do it in the tub, but unfortunately I was so dehydrated that it wasn't the best option for me. But we did it on the bed, which you put down all kind of stuff, so it's not like my bed was an area that was uncomfortable to be at. It was the best experience. My father-in-law was there. He was in the other room just in case something occurred, if we needed to leave for my son. But he was there in a back room. My son was sleeping immediately when he woke up. He got to meet his sister. It was just a really wonderful experience. And to know that I could be at home. They got breakfast at Cracker Barrel, the pecan pancakes that I wanted. And it was the best experience to know I didn't have to leave. And I felt like when you're at a hospital, more people feel like they want to come see you, which I support people coming see us. But at home, since it's such a private setting, we didn't have nearly the amount of visitors. And it felt really nice because it could be us. It was just us. And that was peaceful to me. Because again, my house and my home and my tub and my bed are my happy places. Like I'm a home person. So to be able to do the experience at my home, and I really didn't tell anybody beforehand because I thought people would think I'm crazy. Now I'm more than willing to tell people because I think it's a positive experience. They still look at me like I'm crazy, but I think at least I can educate them on the why did I do it and how peaceful and special it was. Like I'll never forget it. And my husband felt the same exact way. Because he had both. And he said, I really prefer being at home. Now we know there will not be baby number 4. But if there was a baby number 4, we'd be doing it at the house because the hospital is not somewhere I feel comfortable being at. My house is my happy place. So that is my story. Thank you.
Well, if you're still tuning in, our next one is going to be Lindsey, Latiolais, and we're going to talk about perinatal mood and anxiety disorders in pregnancy and postpartum preparations. One of the things I love about Lindsey is she has a great postpartum care plan in place for her mamas when they see her while she's pregnant, and I really want her to share that with you guys. Thanks for watching.
Hi, everyone. It's so nice to be here. So I feel like since I've been in the perinatal world, I've kind of been on my own little island, and so it's really cool to be here and to see the community that's been built and all these different professionals. I just didn't even know that this stuff existed. So before I go into perinatal mood and anxiety disorders and postpartum preparation, and you'll see I have a piece of paper with me, I could probably talk for hours about this stuff, so this keeps me condensed to just kind of give you a brief overview. But if anybody wants to know more and to dive into this, I'd be more than happy to do something a little bit longer to give y'all that. But I'll tell you my story first. So I am not a new counselor. I am fairly new to perinatal mood and anxiety disorders. I think it's been a year and a half since I've had my training. Now I've been in the psychology field since 2011. I got my master's degree in 2015, and I initially specialized with children and adolescents. My background is actually in school counseling. And so, which I love children and adolescents as well. But I have two children. I have a 3-year-old and a 21-month-old. After I had my daughter, and I was already a counselor. And so I thought for sure, like, if anybody's got this, I've got this. Like, I've never been more confident in having her. Like, I mean, I'm a counselor for children. Like, this is going to be so easy for me. So I had no issues at all. Pregnancy was great. My birth was great. And then afterwards, I just spiraled. And it was 3 months in after she was born, and my husband is also a counselor. So we have to be very careful about doing that at home. So he was like, I think something might be wrong. And so we talked about it. I knew, I'll say this, I had experienced anxiety before, so I did know that I was high risk. So I did know that. But it just hit me like a ton of bricks. Like, I had no idea. You often hear perinatal mood and anxiety disorders described as postpartum depression. And so we go straight to, well, then you must be sad. Kind of like what Tiffany said earlier, we have our idea of what that looks like, and it wasn't like that at all for me. I was super awake, hyper. I was very anxious. I was obsessed with routines and nap times and just the schedule. Like, if anybody veered from the schedule, it was a nightmare. And so 3 months in, I realized that I did have postpartum. I had to do my own research. People were telling me, no, you don't, you're fine. You know, everybody has this, everybody does this. And it just didn't feel right. And so as I was doing the research, I remember calling my OBGYN and saying, okay, so I have postpartum anxiety and this is what we're going to do. So I was literally advocating for myself. And so that happened. So I had postpartum anxiety. So then you think I would have learned, but my second pregnancy was great. I thought, okay, well, I had postpartum anxiety, so now I know what to look for. So then I was thinking, okay, well, surely it won't be postpartum depression because I've already had postpartum anxiety. So I was very much waiting to see myself anxious again, and that didn't happen. For my son, who was my second, I had postpartum depression. So I had the typical, like, can't get out of bed, hard to even do anything, very, very sad. I wasn't connected to him, had all of those symptoms. And so yet again, I went back to the research, called my doctor, diagnosed myself. And I just started to feel like, how do we not have more in the community? Why is this so taboo? Like, no one talks about it ever. You have the idea that you have a baby and it's going to be butterflies and rainbows and everything's going to go great. And it's wonderful. It's a wonderful experience, but it's also a transition. And I think that's important for moms to know. It's beautiful, but it is an adjustment, regardless of whether or not you are diagnosed with a perinatal mood and anxiety disorder. It's hard. It just is hard. And so I am going to give you all just kind of a brief overview of perinatal mood and anxiety disorders, and then how you can kind of start to prepare in the postpartum period ahead of time. And so so that's basically how I got into the perinatal field. I just thought, well, if I can't find it, I'll be it. So that's how that started. And so, again, we typically think of perinatal mood and anxiety disorders as postpartum depression. It does not always look like that. And more often than not, it doesn't. It is an umbrella of different disorders. And so I'll go through those. So depression, which I think we all kind of are aware of, the typical, the sadness, isolation, feeling hopeless, changes in your appetite and your sleep. That can be more eating and more sleep, or less eating and less sleep. The difference in the perinatal period, and just to be clear, perinatal means from pregnancy onto 12 months after baby's born. So when I say perinatal, that's the range that I'm talking about. It looks a little bit different. You'll see anger and rage in perinatal mood and anxiety disorders. I'm going to say PMADs because it's a mouthful. PMADs, which is different than any other time period. And that's one of the symptoms that a lot of moms are thrown off by. So that's depression. Anxiety again, we're kind of familiar with what that would be, the worries, the what ifs, fear about baby safety, um, fear about, am I a good enough parent? Am I doing what I'm supposed to do? Feeling overwhelmed with the responsibilities of being a mother. So feeling like you have to do everything, starting to kind of feel like if my house isn't clean, then I'm losing it. So that's anxiety. Panic disorder. So think of perinatal mood and anxiety disorders, PMADs, as like an umbrella, and everything falls under this umbrella. So then we have depression, anxiety, panic disorder, which would be frequent panic attacks. So the anxiety is still there. The difference here would be that you're having the panic moments, and so that could feel like shortness of breath. It can feel like you're dying. It can feel like you're having a heart attack, and then what goes along with panic disorders is the fear of having another panic disorder. And so that is a difference between anxiety and panic disorder. And then one of the most misdiagnosed and misunderstood of PMADs is OCD. And so anxiety is the intense worry and fear. OCD would be intrusive thoughts or images that you cannot control, that come in your mind in moments you don't want them to come in. They can be horrific and scary. There are tons of shame and guilt around these thoughts or images. It's important to say though, for example, I'll have moms who are very scared to say that they have images of, their baby falling down the stairs, or they have intrusive thoughts about them doing something to their baby and they're sick about it. It's something they don't want to have. That's a good sign. So it's okay to say that you're having these thoughts, these images, because you don't want them there. So there is no concern as a perinatal counselor that you're going to hurt your baby because you already have the like, oh, I don't want this. But that would be considered OCD. Hardly anyone is ever diagnosed with that, so that goes unnoticed, which is it's important to connect with someone who specializes in perinatal, so they can give you the right diagnosis and then, of course, the right treatment. And then postpartum PTSD. We talked a lot about birth stories, and birthing traumas can result in postpartum PTSD. And it looks a lot like any other PTSD that you might hear about. So nightmares, flashbacks, seeing images that give you that kind of sick feeling like you're living it all over again. So you can have that after a birthing trauma. I think it's important to say too, when we think of a birthing trauma, we think, okay, well, something terrible must have happened. That is not the case. So for something to be considered a birthing trauma, it really just needs to be perceived as traumatic to mom, and that's it. And so, for example, everything can go great during your birth, but if you have a history of sexual abuse, that can be traumatic. You have people who are touching you constantly, who are around you. You have people that you don't necessarily know or feel comfortable with. You are showing parts of your body that are very intimate. And so they may leave that experience thinking this was extremely traumatic for me. And, the doctors and everyone else there may think, well, this was great. This worked. This was baby's healthy. Everything went wonderful. And so it does not have to be that this, really terrible thing happened. But of course, that can be the case as well. And so, if your baby or you are hurt during the birthing process, that can be perceived as traumatic. Of course, if you lose a baby or any of those types of things, you could leave with the possibility of developing postpartum PTSD. And then bipolar disorder. So bipolar disorder is basically mood dysregulation. So the ups and downs and moods, moments that are really high and then moments that are really low. Sometimes there are manic moments. And during a manic moment, you are highly energetic, euphoric in the sense that everything is great. You're super positive, super confident. Not necessarily feeling good, though. I think that's a misconception. So a lot of my clients who feel manic feel like they're jumping out of their skin, like they can't stop moving or stop thinking. Impulsivity, poor decision making. So making a life altering decision in a manic episode, like I'm going to divorce my husband and leave my family, in that moment. So that is what bipolar disorder is. This is a very tricky one. 70% of women who are diagnosed with bipolar disorder who get off of medication during pregnancy become ill. And sometimes that can turn into a significant PMAD after pregnancy, and can also transition into postpartum psychosis, which I'll talk about in a minute. So if you have bipolar disorder, you can absolutely have children and be okay. I'll say that. But you do need to be really careful in how you prepare during pregnancy and after pregnancy. And so if you're on medication, making sure that you're connected to someone who specializes in perinatal, so they can give you the best medication recommendations. Some medications, any medication is going to cause risk to your baby, but so will developing a PMAD that is untreated. And so a lot of times research kind of weighs the pros and cons, and the same risks, which are typically early birth, low birth weight, developmental delays, cognitive delays, all of that can happen with an untreated PMAD, also with a lot of medications. So when you're weighing the pros and cons and you're looking at the statistics, you do have to be very careful. Not everybody needs medication. I am absolutely holistic in that I think that's the very last resort. But again, with bipolar disorder, you just have to be really, really careful and be with people who understand the perinatal period. And then postpartum psychosis. And so typically those who experience postpartum psychosis have had a history of bipolar disorder. Typically they are off of medication. Postpartum psychosis is usually a very sudden onset, so usually within the first 4 weeks, but can get more severe. In postpartum psychosis, and I'm not looking at the percentage, I have a piece of paper, but I want to say it's like 2%, don't quote me, but are at high risk for suicide or killing their infant. And I'm not sure if any of you are familiar with the Andrea Yates story. So she is pretty famous now for this, but she killed all 4 of her children, and she was prosecuted. And one of the things that they said was that she had no remorse in when she spoke. And so as we started to do more research and as we're learning more and more about postpartum psychosis, we discovered that that is what she had. And so the difference, when I talked earlier about OCD, those intrusive thoughts that can be really morbid, you're worried about those things. You don't want those thoughts. The difference with postpartum psychosis is you don't necessarily have that. Like, you totally believe this is what it is. You are very much okay with the decision that you're making there. So there isn't any remorse because you're in a psychosis. You're in a moment. And so finally so since then they have I saw a baby, I got distracted. Yeah, so since then they have an Andrea Yates Fund set up. She is now in a psychiatric facility and she will spend out the rest of her days in there. So since then we've learned a lot about it. But again, very important to be connected to people who understand the perinatal period.
I have a question.
Sure.
So how does therapy play into someone getting medication? Like, I know that you don't prescribe, so tell me about that process. If we find someone needs help, what does therapy versus medication type of doctors?
Sure. So therapy is where I would always start. So I'll say that. Again, I think medication is the last resort. You always want to do everything that you can without medication. It gets tricky when you're already on medication, especially. So speaking to a perinatal counselor specifically, you'll talk about what your symptoms are, how severe your symptoms are, how frequently they're happening, and then we kind of go from there. So sometimes I am referring my moms to a psychiatrist. When I am referring to a psychiatrist, I do make sure that the psychiatrist that I am referring to is someone who understands the perinatal period. If they do not, my next question is, are they open to speaking with me as they make their decision? Some medications are safer than others, and a lot of doctors have their go-tos. So, okay, you're suffering this is your symptom, this is the medication you get on, and that changes in the perinatal period. You really do need to be kind of careful with that. So if your doctor's open to speaking with a perinatal counselor, I think that's wonderful, even if they don't understand.
And you're talking OBGYN
OBGYN, yes. Yes, there are some psychiatrists though in the area who are starting to be interested in it. So sometimes it's psychiatrists. I have one in particular that I'm thinking of who is starting to get interested in thinking about training. And so once that happens, she'll probably be one that I also refer to, because I think if you're specializing, obviously, you know, you have the education and the awareness and the research of what medications are best. So as far as therapy goes, so it depends on what your symptoms are. Depression, anxiety, PTSD, a lot of stuff can really be worked on while processing. And I think our society glamorizes motherhood and makes it seem as though it looks like this. You have a baby, you're immediately connected, immediately feeling wonderful. The transition is so easy, everyone's happy. It doesn't always look like that. And so giving a mom a space to say, like, this is hard, this is not the experience that I'm having, this is how I feel, this is what I'm thinking, all those things that you don't say out loud or in public or to other moms who also seem like they're holding it together. I'll never forget after I had my son going to Target, and these like moms who were so fit in their workout clothes, like 5 kids in their basket, and you look at me like, what is happening? What am I doing wrong? You know, and now as a perinatal counselor, I can absolutely say with confidence, they were struggling too.
Yeah.
Like, it's an adjustment regardless of if you had a PMAD, and we just have to be better about saying that and making that okay. So there's a lot that can be done with just processing in therapy. Again, how we talk to ourselves is really important. So mom guilt is real. The shame that we put on ourselves, the pressures, the expectations, it's supposed to look like this and be like this. And so just being able to throw all that out the window, approach it, talk about it, talk about how you talk to yourself, give yourself some grace, and that it's an adjustment, and your adjustment is going to look different than someone else's, and that's okay. So that can be helpful in and of itself without ever needing medication. There are times, though, that symptoms can be severe and medication can also be helpful. So I'll say this, I don't ever think that medication is the only answer. I do think that therapy and medication is your best bet, and research shows that with PMAD. So having both, but sometimes medication can be necessary. And I'll use my umbrella metaphor again. And a friend of mine who's a counselor in the area uses this as well, and I love it. But medication can be like an umbrella. Like, you don't always have to have it, but when it's storming, when it's raining, it can be really, really beneficial. And so some of my moms get really stuck on, well, like, I can't be on medication forever. It doesn't have to be forever. It just may have to be in that moment to get you to a place where you can receive all the other stuff, where you can benefit from processing, you know, and all of those things. So sometimes medication is the answer. Medication, and a big thing that I'll talk about with my moms as well is, well, how do I breastfeed if I'm on medication? There are side effects. There are some medications that are safer to choose from than others. And so while not being pregnant, your doctor might put you on this medication because it's probably the most helpful. That might change if you're breastfeeding. You may be on a medication that wouldn't be a doctor's first choice, but it's the safest for you to take in that moment. So again, very important to have someone who understands the perinatal period. But in those moments, the decision could be, you know, I'm going to take a medication and be okay with the risks, especially if I'm on the safest medication that I can be on. Every medication has a risk. But again, so do PMADs, and the risks are very, very similar. So when you're in that situation and you're weighing the pros and cons, you have to think about that. But some of my moms will say, well, I'll no longer breastfeed and I'll take the medication. So it's a difficult choice, absolutely, which is why it's important to have someone, you know, to speak with who you find supportive. But sometimes it's a decision that is necessary. Did that answer your question? Okay. And so, so that's basically what perinatal mood and anxiety disorders can encompass. So it's not just postpartum depression. It's a wide variety. And again, doctors are probably not going to diagnose you with that. Insurance doesn't acknowledge it. The DSM, which is what we look to diagnose, doesn't have it on there. This is just in the perinatal world. So we are so far behind from where we need to be. So that's again another passion of mine, is just to rally around women and new families and break the stigmas that you're not allowed to struggle.
So I'm always on the preventative side when it comes to like women. So oftentimes when moms are pregnant, if they've had a history of any type of trauma, sexual abuse or postpartum trauma from another birth, I will often send them to you guys just in something like, hey, so how soon would you say maybe like before birth, or how often, how many visits they should start going before? I'm always like, hey, this
Yeah.
is just to check in.
Yeah.
That way you get an idea of
I
what
mean,
to expect.
especially, I'll go over the risk factors in a minute, but especially if you know that you have one of these risk factors, even before you're pregnant.
Well, right.
Yeah.
Yeah, like sometimes I don't get them before.
Right. So
it's
if you
like,
do
hey,
anytime, yeah. So
turn
there's
on the cars.
so being the most preventative is the best, but yeah, I mean, if there, it doesn't matter how far along you are, counseling can be beneficial, especially when you're pregnant, to start to develop a postpartum plan.
So a lot of those can be like see before deliver.
Oh, absolutely. And let me say this too, because like y'all have had so many amazing stories, and how come like doomsday with perinatal mood and anxiety disorders to ruin the party. But perinatal mood and anxiety disorders are absolutely treatable and absolutely manageable. That is what's the most infuriating thing about it. Like, it does not have to be so severe. So yes, you can prepare ahead of time and put everything into place that you need. You just need to know to do that. And that's where, you know, building that awareness is really, really important.
Okay. So mostly just like sure. Like so I don't have to, but in the future I've always thought about maybe even like just doing like check-ins with like someone, like you'd be like, hey, maybe like months just to be like aware, like
yeah. So it would depend on if you already have a pre-occurring diagnosis,
right.
Even without. So let's say like I struggled with anxiety before. Had I gone back in time, I probably would have just continued counseling on a monthly maintenance, maybe even every other month, just to kind of, especially when I knew that I was going to have a baby. So just kind of keeping that maintenance, checking in with someone, making sure that I'm talking to myself in a way that is best and most helpful for me. Making sure that I have a healthy lifestyle, good coping skills, all of those things are really, really important. Yeah. So yeah, I do. So I'll say that again, that PMADs are absolutely treatable and manageable with the right help. When PMADs are not resolved, so we say perinatal is from pregnancy to 12 months. When you do not resolve a PMAD, let's say you just kind of fight through it, white knuckle it, as we say, you usually have long-term effects. And so what typically we see, which is interesting, because this is where my background in children and adolescents kind of came into play, and they really do play a hand. Once I started getting trained in perinatal, I started to look at a lot of the kids that I was seeing and the attachments they had with their parents. And a lot of times they came back to the perinatal period, and moms and dads who, which I'll talk about in a minute, had PMADs that were not resolved. And so that can create an insecure attachment with children and families. And so it has long-term effects if not treated. Many people don't understand that fathers can also have PMADs. And in fact, if a mother has one, fathers are 50% more likely to as well. Yeah, so again, it's easily treatable and manageable. You just have to kind of know to reach out and get that support. So risk factors. I get a lot of questions about this. I see clients who, like I have a couple of clients who are not trying yet, but want to try, but they're trying to be as preventative as they can because they know they have a history of or diagnosis of whatever their diagnosis is that puts them at high risk. So I'll go over the risk factors. So history of depression, anxiety, OCD, those are all risk factors. So doesn't mean you will have a PMAD, but you are more likely to if you've had that. Thyroid imbalance, diabetes, endocrine disorders, pregnancy complications, delivery complications, any fertility issues. So if it was really difficult to get pregnant, that can be a risk factor. Miscarriage or infant loss is a risk factor. Severe PMS symptoms, that's one that not a lot of people realize, but if during PMS, it's very obvious that you're PMSing and like you have those really high mood swings, you can be at a higher risk. Financial stress or poverty. So 1 in 7 women are diagnosed with a PMAD, 1 in 3 women of color. And so you can see the difference there even. So racism, discrimination, those are all things that can put a woman at higher risk of developing a PMAD. Abrupt discontinuation of breastfeeding, which not a lot of my moms understand. So if breastfeeding for some reason is not working, using the example we used earlier, let's say that you get on a medication and you decide, I'm not going to breastfeed, you do want to wean slowly off of that because that can also put you at risk for developing a PMAD. History of abuse is a risk factor. An unwanted or unplanned pregnancy is also a risk factor. And so I'll go into, I don't know how I am on time. Is Kyra right there?
I'm right behind you.
Okay, am I okay on time?
We were actually ahead of schedule.
Oh, great, okay. So I'll go into the postpartum preparation. So the most evidence-based preventative factor is support. So getting support around you. Therapeutic support is great, but any support, like your family, your spouse, your friends, people who you can call, people who you can ask to help you. And I have, which Kyra was speaking about, the postpartum support plan. So I don't want to take full credit for it. Part of my training for perinatal counseling had a postpartum support plan. We tweaked a couple of things on it, but for the most part, I keep it. Every mom that I see who is pregnant gets a postpartum support plan. I thought I had it in this copy. So the here it is. So the postpartum care plan basically has you go through these things before you have a baby so that you can start to prepare. So for example, sleep. How much sleep do I need or expect every 24 hours? So we know with a new baby, your sleep is going to drastically decrease. If you have any of the risk factors that are mentioned, you are high risk of developing a PMAD. And so keeping in mind that even though you have a newborn, you do want to get as much sleep as you can, which is probably the second most preventative method that you can do is get enough sleep, which again, very hard with a newborn. So being able to ask for help. And so one of the good things about the postpartum care plan is you're able to kind of talk about this with your spouse or with your family and have people talk about how they can help you. Where will the baby sleep? Thinking about that before baby gets there. I remember I had my daughter. I didn't do any of this stuff. Like I didn't even think about that. Like I just was so confident, like I got this. And I didn't. So even if you are not high risk, I would recommend this for anyone. Just because it makes you think about things ahead of time. Who will care for baby at night? So maybe you know that you're higher risk and you need a certain amount of hours of sleep to feel okay. So who can come? Can your mom come? Can a family member or a friend come? A night nurse. I've had moms use night nurses who know that they cannot suffer from a loss of sleep. Feeding, what do you plan on doing? Again, this is a flexible plan, so sometimes we're just not able to do the things that we write about in here, but just kind of going over it ahead of time can be really, really helpful. Meals, this is a huge one. I have a mom who's was on her third. She had her third baby, and I mean, she had 2 other little ones, and so like the stress of like I can't even imagine. I have 2 little ones, like that's a lot. And so she had frozen meals prepared. She had people, because people will bring meals usually, but not for a long period, not enough, yeah, and not for a long period of time. And so she had all of these meals prepared. Her mom and her mother-in-law had come over, and just like they had a huge deep freezer and just made all these meals. So she had everything that she needed ahead of time, so dinner was done. So just being able to kind of think about those things ahead of time. What are ways that I can practice self-care? Maybe that's making sure that you have sessions already planned with your therapist. What foods or items provide me comfort? So just kind of writing all of these things out. Visitors. This is one that somebody mentioned having too many visitors in the hospital, and I had that twice. So really just thinking about, what do you feel comfortable with? Some people are okay with that. Some people don't want as many visitors. So kind of writing that out and talking about this with your spouse so that y'all are on the same page, so that the day of, it's not one person wants 5 people and you want none, right? So relationships, thinking about your spouse, your friendships, your families, who can help. And then roles, another one that comes up a lot in counseling, are mom and dad or spouses, their roles. You totally shift, especially if you were together for a while before you had children. Like, everything changes, right? Like, baby is the most important thing. And so how do you get back to where you were before? And unlike what media tells you, being a mom is not always sexy or glamorous. And so trying to even think about those things when you're in a relationship. And then consider who will do the following: changing diapers, bottle feeding, burping the baby, taking the baby on walks. And so really just kind of talking about these things ahead of time is really, really important and protective. Another thing that I want to share that is really great, and I mentioned before that I felt like I really had to advocate for myself. This is perinatal mental health. It's a perinatal mental health discussion tool. PSI, so Postpartum Support International, has this on their site, but I can certainly give Kyra some copies if she wants to put it online for y'all to have. It is basically, you go through and you talk about all of the symptoms that you're experiencing. And so let's say that you're seeing an OBGYN who's not familiar with perinatal counseling or perinatal medication or whatever, and you feel like they are not concerned, but you are. You would fill this out, bring this to them, say, these are the symptoms that I am experiencing. I don't feel like myself. I feel like something is not right. They'll take this, and then there's even it's a free psychiatric consult line. So they can actually call a psychiatrist who specializes in perinatal medicine or even just diagnosis, and talk with them about the symptoms you're specifically feeling, and they can get that help. And so you make sure that you get the best treatment possible. Yeah. So this is a tool, a really good advocating tool. And then, so let's see, I lost my page. So we're talking about, so how you can prepare for postpartum. So healthy lifestyles, yoga, mindfulness, great for postpartum preparation, exercising, eating well. I think I covered everything.
Does anybody have any questions? Go ahead.
Sure.
It's a contingency scenario, but it does happen from time to time. Situation with a mom who's actually like more psychosis or on that end of the spectrum. Of course, just over the last 2 years, we actually have sort of internal mental health. But even now, like in that situation, I know it did go. So it's like a 911 type of situation or a emergency situation, but after that, they've always just been not taken care of.
Mm-hmm.
So like, if that's a situation these days with the resources we have now, of course, it would be an immediate emergency visit.
Right.
But from there, how do we advocate for those types of
Yeah. So knowing that going into, for instance, an intensive inpatient facility would be 24 hours watch, right? You're there usually for 7 to 14 days. As soon as you come out, they'll do it even there. They'll have you create an outpatient plan. Having that mom go straight into therapy would be really, really beneficial.
Are they separated?
They are. So I hope that we get better about how we handle PMADs anyway. But at this time, if you go into a facility, then yes, you are separated from her, which It's horrifying, right?
And
And damaging to everybody.
Yes.
Yes, absolutely. Or a spouse, because if you're in the moment where you're experiencing psychosis, you're not in reality. So even your spouse knowing that, okay, you're going to go for 7 to 14 days, what are we going to do with the baby we just had? Because it usually is an early onset, that prevents them from even reaching out and getting help for their spouse, thinking that like, okay, she'll just kind of get through this. And that isn't always the case. And so, yes, we could definitely do a better job. But having, so even the family members talking about, even ahead of time, where would you want your baby to go? Who would you feel most comfortable? And then even having those family members go into therapy even before mom goes in to kind of help them. But yes, did I answer your question?
I think so.
So I would go
the emergency room visit first.
Emergency room visit, which if that mom is experiencing psychosis, would probably lead her to inpatient for 7 to 14 days. And then straight into a counselor who specializes into perinatal to maintain and manage and get her to hopefully advocate for her and get her those resources that are beneficial. Yeah.
Any other questions? There's a whole crew behind you. You can't even see.
Really?
Yeah.
Hi, everybody.
So, thank you, Lindsey. We're gonna take a 5 to 10 minute break. Let y'all get snacks and mingle and restroom breaks. And when we come back, Jenny Thompson's gonna talk to us about doulas and childbirth education, and we're gonna have another positive home birth story.
Can I say something really quickly
Yeah,
about
go
the
ahead.
climb event tonight? So I totally forgot about that. So I am with Ivy Sias. We are doing the Climb Out of the Darkness event. She is leading it. I came in late in the game. Catherine Aber, who is also a perinatal counselor, is helping us with this. We actually have the event this afternoon. It is free to the public. It's from 5:30 to 8:30 at Munkus Park, which is where the farmers market is. There will be a walk at 7 o'clock from 5:30 to 7. We have a fun jump. We have food and refreshments, so everybody can kind of hang out, get to know each other, talk. This is a fundraising event. Again, it's free to the public though. And it's also to raise awareness for the mental health of new families. So this is really, really important in our community. I think that we need it. So just letting y'all know this is tonight from 5:30 to 8:30. So thank you so much, Laird, for having me. Thank y'all.
So, we're going to be a little bit over time today. We were supposed to end at 11, but looks like we're going to be ending closer to 11:30. We're going to wrap it up with Erin's home birth story, which is really good. And if you guys know who Erin is, she posted her birth story online maybe about 2 weeks ago, and it was just such a huge hit. So I'm going to be sure to post that up this coming week. And then Jenny the doula and I are going to have a conversation about what a doula is, and what a doula is versus a midwife to wrap up today.
Hey y'all, I'm Erin. This is Juliet. Can you say hi? She's 7 months yesterday. So my story, I have a 2.5-year-old who I had in the hospital. I wasn't really educated on birth, I guess you could say, at all with my first. I just trusted. Well, first off, I didn't really know that you could have a birth outside of a hospital. I did have a cousin, or I do have a cousin who had 2 home births, and I just thought that was like crazy talk. So anyway, I had my first in the hospital, and I had a pretty good experience leading up to the birth in the hospital. And then, and actually even the birth was great, but the recovery was awful. And I ended up doing a lot of like pelvic floor PT afterwards. I actually saw a specialist in New Orleans who told me that my situation was so severe that I couldn't have kids for 5 years. And I was like, there's gotta be a different way. This is like the most natural thing that we could do as women, and there's just gotta be a different way. So I kind of started doing a little bit of research on different styles of birth, and like looking at statistics. Also, my husband is in the medical field. He designs clinical
clinical studies for drug companies. So he's like as scientific as you can get. So the idea of like the idea of a birth outside of a hospital was just crazy to him. But he was open to hearing. So I actually went over to my neighbor's house, who's my cousin that had the 2 home births, and I was like, "Tell me more." I was like, and she was familiar with my experience. Just to kind of touch on that, I was induced after only 2 days of going past my due date. I was really swollen and uncomfortable, and I was just ready to get the baby out, honestly. So my doctor induced me. I tried to go natural. If anybody knows, contractions when you're induced are like awful.
You can stand up.
Yeah, I'm gonna stand up. She's getting a little
You want me to
crazy.
take her?
Yeah, if you want. I know you like to rock a baby. So contractions were really intense, but like I didn't know what to expect. I was going in this completely blind. And I don't know, I wasn't progressing. All the things that you probably have already read up on typical like inductions were happening. So I wasn't progressing. Finally I passed out on my husband, and when I came to, he was like, "Okay, we're getting the epidural. Like I can't see you like this." Got the epidural. The epidural allowed me to relax. And then I started progressing. So I don't even know. It was like a full day of labor, but ended up one push and she came out. She came out like literally busted me open. When you have a really good epidural, you can't feel anything. And they were like, I was like, "What do I do? How do I push? I've never done this before." I wasn't educated. Nobody told me really anything. The nurses did help me through practice pushes and everything, and they were wonderful. But I just didn't know what I was doing. And so they were like, "Push like you have to poop." And I'm like, "Well, I can't feel, but okay, I'll try." And she came out. And the recovery was really hard. I didn't realize that I'd be in diapers for so long. I probably bled for 3 months, which is like really long. And I experienced prolapse and just all these really ugly, unglamorous things. I went over to my cousin's house. Probably, I think my baby was like 6 months or so. She kind of told me a little bit about her experience with home birth. But I was told by my specialist that I couldn't get pregnant for 5 years or so. Well, we got pregnant, and we had too much to drink at a friend's wedding, to be honest. And we got pregnant, and the first thing I did, obviously, is called my doctor. I went in, and she took a look at everything, and she actually kind of countered what the specialist had said, and said, "No. Like, I don't know what you were told, but this is going to be a safe pregnancy. You may be very, very uncomfortable because of your situation, and you may be leaking urine, like starting really early on." I love. And I was at 9 weeks, I had to start wearing diapers again. I like just urinated on myself all the time. So I actually, when I started really diving into the research, and I made my husband sit down with me one night, and we watched the documentary Business of Being Born. Yeah, it was eye-opening, maddening. And I kind of felt like I had been played in a sense, and I get the chills like saying that. Because it, in a sense, to me, I felt like I feel like women are sort of made a mockery of, when we should be celebrated, and we should be like a natural birth or even a home birth should be like what we all strive for, because like we were created for this. And I feel that so strongly, like in my bones. I just want to like scream it. So when my husband saw that, he works in the hospitals, and he was like, "Wow, this makes actually a ton of sense. Let's just kind of like pump the brakes a little bit. Let's pray about this a little bit. And that's when I called Kyra. I believe I was
35 weeks.
Was that 35? I think it was 30, 32-ish. Yeah, 32. Called Kyra. And at the time she wasn't doing home births, and I was so set on a home birth. I only live like 7 minutes from the hospital. So like driving out here, if something were to go wrong, you know, the idea of being closer to the hospital made more sense to my husband. I didn't really care because I was like, I'm not going to the hospital. But you never know. Anyways, she called me back and she was like, we'll come to your house. We'll do a home birth. It's like, oh, like everything's like the stars are aligning. So, and also I have like the freaking most amazing bathtub. It's like in the shape of a 4-leaf clover. It was like built in the 70s. It's got stairs into it. And it's like, I just like.
Can you rent out your bath?
I mean, I might start doing that. I need a little side hustle. Yeah. So I just like would get in the bathtub every night and envision myself in this tub. So, and then I ended up I used it to labor in, but didn't even have a water birth. So, you know, let me touch on this. So when it was time to tell my doctor, like, hey, I'm leaving, I didn't actually do that. I just kind of like jetted out. We played phone tag a little bit, and then I ended up not speaking to her, not because I have anything against her. I loved my doctor, but I just knew she was going to try to talk me out of something, and I had to remind myself, like I had to stay focused of who I told my ideas to, because people that don't know this world, they think you're nuts. Mm-hmm. Things that may be like unconventional make them very uncomfortable. And the hospital realm is like what they see as safe and comfortable. And I knew that like I couldn't tell but maybe 3 people who like totally know that like, you know, Erin isn't just somebody who's going to just do something. I will do something on a whim, but I'm going to make sure I know just about everything I can know before I like make a solid decision, especially when it comes to the health of myself and my baby. So we played phone tag a little bit. I ended up saying, like, I'm not going to tell her. I knew she would try to talk me off the ledge, so to speak. So I didn't tell her. I actually didn't tell my parents until 3 days before she came. 5 days before. I told them on my due date, and Juliet came 5 days later. We didn't tell friends. It was just like our little secret. And I'm so glad that it was that way, because I didn't have anybody in my ear like trying to tell me otherwise. So let's see, let's just say like 37 weeks, 38 weeks. I started doing like all the things like at home that could maybe help you like naturally induce yourself. I was like stretching. I was like, I'm not going through what I went through, the ripping, all the stuff. And then I guess it was 40 and 5. Yeah, 40 weeks and 5. I came here. I think I was maybe 1.5, 2 centimeters. Kyra checked me. And then we decided to do a sweep. And we did a sweep. And I think I left at like 4 centimeters. Like it was like that quick. Yeah, it started going. And I was contracting, but I couldn't really feel. Went home, kind of rested a little bit, because something told me like maybe it could be today, but I feel really good. I don't know, maybe it'll be in 5 days from now. Did some walking around the neighborhood, bounced my ball, whatever, went to the chiropractor. He just did some like pressure point work, and as he was adjusting me, I started contracting like hardcore, like something just kicked me into labor there. Get in my car, get home. Within like 1 hour, I was actually in full-blown labor. That was at like 8 p.m. And I think my husband called Kyra and Rachel at like 4 a.m. maybe. And I think you guys showed up you came first, 4:30. And then I think you got there around 5. Baby came out at 7, I think. It was like it was just the way that it was all supposed to happen. And I know it's not for everybody. I know that it doesn't just always happen that easily for everybody. But I just wanted to prove to myself that like I could do this and prove to everyone who was like against me in a sense, for that, like, this is so normal. It was hands down, it was very, very hard, very painful, but like in hindsight, now looking back, I don't remember the pain. I tore a tiny, tiny bit, to which they didn't even stitch me up. In fact, I remember after Kyra was like, let me check your pelvic floor. It had healed itself. It like, that's crazy talk. Like, it had healed itself, just letting my body do what it was made to do. I have not leaked a single bit of urine since then, even when I sneeze, work out, jump with my 2-year-old. Like it is completely healed, and it healed in that moment. I just trusted my body to tell me what it needed to do, which was the coolest thing. Like, looking back, you know, in the hospital, they make you lay on a bed on your back, and you're like, nothing's working in your favor. Gravity is, you know, not working in your favor. And so I labored like on the ball a lot, and then in the tub I labored a lot, which the hot water is incredible. And I had dreams of giving birth in the water, but what it did for me is it made me too relaxed, and so like it wasn't allowing me to get complete. So we moved into my bedroom, and I just endured, you know, the contractions there. And I think it was like something was like, okay, Erin, like, let's get on all fours. Let's just like try this like a dog, you know? It's kind of funny how like you kind of turn like this animal mindset. Yeah, that was me. And if also like I had an amazing doula. My cousin is a doula, and she came over and she just like killed it with the counter pressure, like squeeze those hips. And also like when I'm on all fours, she's like right behind me, you know, like butt in her face, just like in it. And I pushed a few times on all fours, and like she just came out. My husband caught her. And it was just so cool. We could just get back in bed, and they tucked us in. My husband made bacon and eggs and almost burned the house down. Really though, like walked in, the smoke detector was going off. You're just in this bliss, you know. So we forgot that we had bacon on the stove. We couldn't get that smell out. Like, thank God I wasn't pregnant anymore, because I would have vomited everywhere smelling that. But it was just incredible. And then postpartum care was great because they came to me and to the baby and made sure, you know, things were all good. Note just for pregnant mamas, in the hospital, you have that golden hour where, like, you know, it's lactation comes and they kind of work with you on breastfeeding, and you have all that time, skin to skin, whatever. Well, this was like a golden, like 5 hours. You know, they stay with you and make sure you're comfortable. Juliet had a really hard time latching at first. I have like unfortunate nipples. The best way to describe them. They're really sad. And they've gotten a lot better though. But so she wouldn't latch, and it took like a good week. So I had to like syringe feed her. I would like pump a little bit, syringe feed her for a little while. Luckily, like newborns, they don't need much those first few days, and the colostrum was thick and like could hold her over. But I had like Kyra and Rachel and my cousin and Jenny came over one day, and helped me with latching, and like it was just so great to have a community of women who get it and are like, this is so important, like the bond and like the nutritional value and all the things. And we got it, and it has been, I didn't have that with my first. In the hospital, they were like, oh, well, golden hour's over, your baby won't latch, here's a nipple shield. And they don't tell you how horrible the nipple shield sucks. And it's one more thing to keep clean, and then it falls off, the baby knocks it off, like it's just an inconvenience. So with the first journey, I exclusively pumped for 7 months, and that was awful too. this time it's been 7 months. I've had an amazing breastfeeding journey because I had people that cared, that were like, we're not going to stop until you get this. And it's just like, everybody deserves that. And I'm not saying one way or the other is better, although I am saying that. I don't think I could ever go back unless, you know, like a health issue warranted it. But and I think you can get some level of that care in the hospital if you bring on the right team. But for me, that team was here and it just made so much sense. So I highly recommend like diving into the research if that's what is, you know, something is telling you to do that. Diving into the research, the statistics, not being afraid of letting your body do what it's supposed to do, trusting your body that it's going to tell you what to do, because it is the most instinctual thing I have ever felt. And also like having a really great support system. Once I told my family, they were a little like, are you sure you want to do that? You know, because they didn't have any education on it. And I said, look, I remember having this conversation with Mom. No, I don't think you should do that, Erin. Okay, lady, what research have you done? Because you don't get to have an opinion about this. I love you, Mom. You're watching. You're not. She was like, oh, yeah, you're right. You're right. I don't know anything about what I'm talking about. It's just really scary sounding. It sounds barbaric, right? It's like people do this in a field like centuries ago. But there's reasons for that. So anyway, that's my story. It was an amazing experience. It's been an amazing postpartum journey. I was trying to think back on my first postpartum journey and how much I cried. And this go around, just I don't know if it's like because there was no medicine involved or if just it was peaceful and all the things. But my baby has been the chillest baby from the beginning. She may not be right now because it's nap time. Oh, she has been happy. It's been easy. And you know, the only days that have been really hard is like because my toddler is 2.5. And I don't get me wrong, the beginning was like overwhelming because I had two at home and I had to learn this new adjustment and this new life of 2 under 2. But it's been so positive. And like I'm trying to find my place in this world of how I can advocate for birthing mothers or just natural childbirth in general or natural everything, because it's just opened up more avenues and more rabbit holes. And you know, so oh, sweet angel. So that's I could talk about it forever. I'm gonna just stop there. But yeah, of course.
All right.
Okay.
So our last little segment is going to be my longtime friend and local doula, Jenny Thompson. Jenny the doula online, and we're going to talk about doulas and doulas versus midwives.
Yeah.
And I think childbirth education. So go ahead.
Yeah, and so I'm not gonna be like a long time. I just wanted to comment. I did get here like a little bit late, but I know everybody that spoke today, and I just wanted to say how awesome it is that everybody is here, and that it really does take a village, like from doulas to encapsulationists to therapists to chiros to massage therapy. I'm glad that it's becoming, well, we're trying to make it more mainstream, but like, was it Erin that said, yeah, everybody thinks we're weird. So
Yeah.
welcome to the club. We're all weirdos, which really, we aren't weird. We're just trying to bring back like what has been normal for a long time. And that was just taken away from us. So again, I'm going to introduce myself and then we're going to talk about doulas for a second. So my name is Jenny Thompson. I've been a doula for 12 years. I am also, I have an office exam room here at the BirthHouse. I do encapsulations here. I do births everywhere. I'm also a Lamaze certified educator and a lactation counselor. So kind of do like a little bit of everything. But I thought I'd do something, I guess we're kind of doing something maybe a little bit different. I think I'm going to talk about doulas a little bit and then we're going to
talk about the differences between midwives and doulas or something like that.
Meet the doula night in condensed
Yeah.
version.
So what I wanted to say though was like, okay, so what I heard from like everybody today is like in general, like there's just a lot that is unexpected in labor and delivery and like postpartum. And last night before, in kind of planning for today, I was like, I'm just going to like Google what moms say about labor and delivery that they didn't know, or what's like the one thing that they just want to know about labor and delivery and postpartum. So I just want to read like a few. Okay. So some moms, this was like I think an overview of like 2,000 moms wrote into a few like blogs and said what they would want other people to know. So what you need to know about contractions. One mom said the contractions are the hardest part and hurt more than actually pushing the baby out. Another one is let's see. There's no such thing as a birth plan because your baby doesn't care about your birth plan. And an OB nurse kind of said the same thing. Another one, it's okay if your birth plan doesn't go as planned. You know your body better than any other nurse and doctor. Speak up sooner when you know something isn't right, and next time can be different. Then here's what you need to know about epidurals. Not everybody loves the feeling of an epidural. Talk about a major panic attack and not being able to move half my body. Epidurals are not always able to be placed on the first or second try, and they can wear off. Okay, let's see. Another thing about what moms wanted to know about pushing. One mom said, I had to hold my own legs and push. Most of these moms are hospital. The reason why I'm talking about some of these is because birth does not have to be like this. And, maybe I'm preaching to the choir, but you won't be like the Instagram stories where they only had to push 3 times. That's true. I only pushed for 45 minutes. I say only. Yeah, I only pushed for 45 minutes, but I didn't realize how long it would take. And I was super annoyed that the nurses wouldn't call for my doctor when I started pushing. And then one mom was like, pushing with a stuffy nose is really hard. Let's see. You may not always have the urge to push. My first 2 natural births, I had to gut it out. I never felt that urge. With the last 2 births, I did, and it made pushing so much easier.
Maybe she just needs to wait longer. Yeah, we were all every breath we're pushing was like, wake us up.
It's like there's so much. Yeah. Okay. So some of these are really good. What you need to know about how long labor can take. It might be longer than expected, days and days, but you are stronger than you think. That was sweet. How exhausting it is. 27 hours of labor with my first daughter, and I was completely exhausted. And she said, one mom was like, this is TMI, but I would have had them give me place another catheter before the epidural wore off because going to the bathroom was not so much fun. I wish I would have known how great skin to skin would be with my baby immediately after the birth. With my first 3 babies, that wasn't something that the hospital did. With my 4th, it was a priority. It made such a huge difference in his transition and in hers. You'll look 8 months pregnant after you have the baby.
I did not know that.
Yeah.
After my first.
It surprised me that the uterus checks afterward hurt worse than the labor itself.
Oh, yeah. Sorry to all of you.
I know. And then I'll end with how beautiful and magical it would be to not be scared. So yeah, when I read some of these, I was like, oh, like this is heartbreaking. But at the same time, when Cara was like, talk about doulas, I was like, okay. And then after hearing what everybody was saying, I know that and the other doulas I know would agree with me because we have a lot of really experienced ones in here that, I guess the great thing about doulas is that, we can be that like resource, like it seems that over the past 10 years, more and more people kind of know what a doula is now. So, you know, what I loved about the doulas that I had, even just like almost 15 years ago, was that they were definitely that point source for information, and that's one of the main things that doulas do is do informational support, physical support, and emotional support. So a lot of times, many of us will get phone calls or texts from other moms like, I'm peeing on myself, like Erin was talking about, or um, I'm having these strange feelings and emotions. What can I do about it? My baby's breech. What can I do? I had postpartum depression last time. Like, what can I do? And so I'm so thankful for all the doulas in our area that that are just here. Like, take advantage of them because they can point you to exactly everything that you need to like create your village and to create your to have a good pregnancy and labor and delivery and postpartum, because when moms are hiring us or talking to us, you know, especially now that we have the perinatal, I don't know, is Lindsey still
She
here?
just
Maybe she
she
just
just
left.
she's got
Um, so, oh yeah, that's right. Um, I lost my train of thought. It's nice to be able to point them to all of these people before labor and before delivery rather than like after. Like I think Elena had said, like we try to do preventative like as much as we can, and then if you need that umbrella of like medication or other types of help, then like that's there. um, so that being said, I wanted to like talk a little bit about doulas and what we do and like what we don't do. So again, we provide physical, informational, and emotional support for the mom and the spouse or the partner, just the entire family. We see the whole family unit like as one. We don't take the place of the spouse or partner. Um, we also don't take place of the care providers. So everybody here has heard this before, but we always say that we make, you know, it a great birth, and it's everybody else's job there to make it like a safe birth. Um, we also lower your instance of a C-section. We lower your instance of an epidural or other medications. We lower your instance of having a assisted birth, which is like the suction cup or like the forceps, the salad tongs. And then overall, we like help moms and dads or partners to have a more like positive birth experience. So kind of like what Erin was saying, that, you know, trauma really is just, it's perceived. It might not, like a birth might go great, but, you know, having a doula that you've met with a few times before, you know, labor and delivery, you know, can help like the can help the family. Like she knows what might be like a little trigger for them or what she wants or doesn't want. So that is that trauma is either not revisited or like just doesn't happen. So there's so much that doulas can do for families, that, you know, again, I can't speak enough to it. I know I had doulas for both of my labors, and if it wasn't for them, there's, you know, it's not that I couldn't do it. Like doulas are not just for natural births; they're for all types of births. So we have all been to inductions and unplanned C-sections, emergency C-sections, planned epidurals, planned, you know, all the things, because we're there to help them not have that traumatic experience, for it to not be unexpected. And doulas can also point you to like the right kind of childbirth education class. Like that's part of what I do. So, um, you know, having that team there, having a doula and having an educator and having an encapsulator, who are all willing, like don't let money like be um a barrier to this, because there are more and more ways thankfully, that you can have it apply like to your deductible, or have insurance pay for it, or have your HSA or FSA pay for it. And then a lot of us, work in different ways to like help moms get what they need. And of course, we're going to help a mom in need if she, has to get to somebody like quickly.
The Christian-based health insurances as well cover the cost of doulas. If I'm not mistaken, it might be 100%. So you would know. Is it Samaritan's Ministries and Christian Health?
Yeah, not Medishare, but Samaritan for sure. And there's another one that they either have an allowance, so they pay some towards it, or they pay the whole amount.
Yeah,
So Samaritan is the main one.
Samaritan,
Okay.
so they understand the value of doulas and how much it saves them financially, like Jenny had said about reducing the risk of reducing the rate of your C-sections and all these unnecessary interventions applied to your labor. Women who hire doulas for their labors are less likely to receive Pitocin in labor, less likely to have their water bags broken unnecessarily, more likely to breastfeed, especially long term. And so hiring a doula is so much more to these companies than just, someone else to be at your birth.
Right.
But from my personal experience, so Jenny was my doula along with my office manager, Emily, when I was pregnant. Now, y'all, I'm a midwife planning a home birth. So, like, you think, like, I'm all, crunchy and all in. But when you hit 39 weeks pregnant, like, you're done. And I was done. I'm like, take me to the hospital, induce me, sweep me, do whatever you have to do, get this baby out. And I really learned the value of a doula in that experience, because here I am, 39 weeks pregnant at the end of my rope. And they can't save me. Like, pregnancy and birth is not something to be saved from. And instead, my sister doulas pulled together, and we went and we had like, what did we do? Henna tattoos, and we hung out at Emily's house, and we just hung out and just kind of refreshed my spirit.
We busted you a little bit.
You
too.
did. I deserved it.
I deserved it. I was like, are you kidding me?
But I remember
really
y'all
wanted
loving it. Emily went through it too.
I know.
Like, just get the baby out.
I know.
Hospital.
So yeah, we even have some moms that will put it on their like birth registry, or if it's a second or third or fourth or fifth time baby. I know some people call them sprinkles now or whatever, or maybe they'll ask people for donations, like they're planning a little bit more for those next babies. They're planning for birth. And then I love the postpartum plan, like ideas that Lindsey was talking about.
Yeah, we need to find more ways to implement this postpartum plans.
So yeah, I feel like am I missing something? Y'all know me, I always ask, like, am I missing something?
Well, the only thing we wanted to talk about at the end was we wanted to wrap up with what's the difference between doulas and midwives, because this is such a common question. Is if I have a doula,
I wanted to,
why do I need a midwife?
Yeah. So, okay. So, a lot of times I'll get questions about, well, why would I need a doula if like the nurse or the doctor or the midwife is there? And again, we're there to make sure mom and the spouse or partner have like a great birth. Not, it's their job to have mom have a safe birth. And not only that, like the doula is like the continuous labor support, whereas, the midwives are stepping in and out, the doctor is stepping in and out, the nurses are stepping in and out. They have paperwork and all other kind of stuff that they are unfortunately required to do. They can't be there all the time. They can't. So that is one thing that like we do is that we're the continuous support. But again, it's physical, informational, and like emotional. Doulas do not do anything clinical, which means we don't administer medications, we don't do vaginal exams, we don't do blood pressure checks, heartbeat checks.
Out of the scope.
We're not administering anything. That's definitely way out our scope. So that's what they do.
An example of how they're integrated. So a doula, let's say a BirthHouse client's in labor and it's early labor, but she needs some support. A doula will go out and labor with her at home when it's too early to come to the BirthHouse. Helps her rest, helps her stay calm, helps her husband get rest and gets his stuff wrapped up so that when they come over here, they're ready for active labor. When they come here, the doula is the person in the room continuously laboring with the client the entire time, hands-on, completely hands-on. Now, my staff and I are here as well. We're here, but our job
where we really need to be on high alert is the birth itself. So when doulas, their priority is your labor, where they do expend all of their physical and emotional energy. Our job is the birth, because that's when the risks to mom and baby are at their highest. So we're on high alert. So as much as I used to be a doula and I loved pushing mom's hips together and pushing on their lower back and rebozoing them for hours, the fact is, I remember the birth very clearly, that at one birth, I had labored with this first time mom I was a midwife in training, but I had doulaed her. And by the time the birth came, I was so exhausted. I held the flashlight against my forehead and it was just shaking. And the midwife, she let me do it. She was like, I just wanted you to learn that you can't be both to these women.
Yeah.
And so I'm on high alert when the birth is here, and my job really kicks in then in postpartum, whereas the doulas get to go home usually about 2 hours or so postpartum. Now, both the doula and the midwives check on the mamas postpartum, but again, different roles. Like, we're there to make sure mom and baby are safe, nursing's going well, everyone's emotionally adjusting. I've seen doulas go to the house, bake brownies, do their lactation support. Like, doulas are just awesome, and they're worth every penny. And
they've been around forever.
Yeah.
I mean, if you look at like old, like if you were like maybe you're not a birth nerd, but most of us are birth nerds. And if you look at like the history, not just of midwifery, but of like giving birth, like you always, 200 years ago, 100 years ago, it wasn't just the person delivering the baby. It wasn't just them there. It was like a community event.
Women.
I mean, it wasn't like a big party. It was women. It was like, you had useful people at your birth. I mean, that was how they did it.
And even if they have a good husband, like I've heard this, I'm sure you have too many times, well, my husband's such a good birth partner. That's awesome. But what happens when he needs to sneak out and go pee? Or what if your labor lasts for 24 hours and he needs a snack? I've been in labor before where everyone stepped out the room coincidentally at the exact same time. And when I started having a contraction, I looked up and felt completely abandoned for one contraction. It's very normal for women to need to be surrounded continuously in labor. So this gives him permission to take a breath, take a breather, go grab a snack, while still being able to be involved as much as he wants to. And some dads aren't that great at it. Some dads don't really know where their place is in the room.
And then we get to tell them what to do
help them
to make them like look good.
Put that cool rag on their neck.
And like most moms, I would love for most moms to have a doula. Certainly not everybody does. Like, some dads are great doulas, but dads shouldn't be pressured into being like, some dads are just really into that. But not all dads are, and that's fine. Like, they're men. Y'all are different than us. So,
Can I get you a beer?
Yeah, so that would be awesome. Anyway, so that's unscripted, but there you have it, doulas. I don't know, please, other amazing doulas in the room, if y'all have
Well, I
anything
think
to
something
add.
great to add is that a doula is there to be your voice when you can't speak.
Yeah.
Like, you meet with them, they know your plan, they know what you want, they know your desires. Your husband's at your side, seeing you in distress, know that you're going through pain, and they just want it to end because they want you to be happy and just be okay. But a doula understands what your intentions were, and they'll speak when you can't speak, because half the time you're so focused in what you're going through, you don't even have the words to even say what you want to say. Because unfortunately, with me, every single labor, I had the urge to push before I should push. And it was like I need to push now. And I needed the voice to say, you can't. Because if you do this now, you won't make it. So you have to calm down. So I think that's important to know.
Yeah. I don't know if people can hear. Can people hear?
So.
Yeah, she was just saying doulas can help you be your voice or find your voice. Speak up for yourself.
I'm going to peek on my phone to see if there's any questions.
Oh, yeah.
Because I didn't bring my phone with me. Yeah? Okay.
No one has anything to say. I wanted to like Google that stuff because like we're all so immersed into birth that like we're all hook, line, and sinker, like we're sold on it. But then some of the questions are just so simple, and it's hard to hear like some of the experience that people still have.
Yeah, and there's so many times that I hear people say, if I had only known that it could be different.
Yes. Yeah.
and they don't know what they don't know.
Yeah.
So they don't know what's recent.
Yeah. So Emily was saying, like, most moms are like, I didn't know that it could be different. And so that's why Kyra and the other midwives are, it's their vocation and their calling to do what they do, because birth has it should always be like this.
This should be the norm.
This should be the norm, but it's not. So just know that birth is safe and it's amazing out of the hospital, and it's pretty awesome.
Yeah.
Yeah.
I didn't see any questions.
No.
Okay. Well, thank you, Jenny.
Yeah, thanks, Kyra, for having us.
Have a room full of birth workers, which is really awesome.
Should they
I did at the beginning.
introduce? Okay, sorry.
Oh, yeah, no, I forgot you were here at the beginning.
Well, yeah, we have workers.
We do. So we have a room full of birth workers, and not to point the finger, but maybe just a little bit. I find it interesting that as much as this room is full of us, those of us, we're pretty in the know already about these things, and there's not a single physician in this room in here learning about any of these new things. So I'd like you guys, if you're watching, to take this opportunity to share some of this information with your physician, particularly the perinatal mood specialist, placental encapsulation, doulas. Even if your doctor's not going to be supportive of midwifery, there's so many other things that our community has to offer for not just natural birthers, but people seeking natural health and better birth experiences. So this is what we do, and this is what we love, and we really appreciate you hanging in there with us. And thank you guys for coming. This was awesome. Now take some food home.
Okay.
Bye-bye. Bye-bye.